There are a multitude of variables that impact the process of in vitro fertilization. Variables such as the tissue culture ware, the media, the oil, the protein, the environment, patient etiology, protocols. There's really not a variable that doesn't impact, that doesn't play a role in the success of an IVF cycle. And our team, as most teams, strive to provide absolute excellence towards patient care and offer the highest level of technology that they can, the latest approaches, and work tirelessly to do that. So part of the genesis of the LifeAire system is that despite our daily focus and drive to provide excellence to our patients, we would have something we couldn't even see. We would have something that we didn't even know was impacting our clinical outcome rates, that being the ambient air. And when you have success rates, we were over 50%, 52%. National average was around 30 then. And you counsel a patient, a couple, during that time, and they ask what your pregnancy rate is, and you 52%, whatever it may be at the time. And then by the time they cycle through, 6 months later, if there's construction outside or a fire 2 blocks down, or they've resurfaced the parking lot of the hospital or a restaurant nearby, and their chance of success plummets, that to me is completely unacceptable. IVF is an extraordinarily difficult process for the couple. Emotionally, financially, medically, it's an extraordinary process. And that, to me, not to have control of that variable, not to be able to say to those patients, no matter what happens outside on the day you arrive for your egg retrieval, your embryos will be protected. And despite operating within a clean room, we still couldn't say that. And it was that 10 years of data that led to understanding what we needed to do, what type of environment we needed to provide so that their embryos were truly immune to what was happening outside.